All right, so today we're going deep into Cerec dentistry. And, I've got to say, I'm pretty fascinated by all the stuff you sent over. It seems like, well, is it really like revolutionizing how we think about, getting dental work done?
I think, yeah, it's definitely shaken things up, I mean, just imagine, like, getting a crown in just, like, one visit. No, you got those Mehim impressions or, like, the temporary crowns and no waiting forever for a lab to, like, finish it. That's what Cerec is all about.
Wow, okay, that's pretty impressive. But maybe before we get too far, let's like break it down a bit. What does Cerec even stand for? It sounds kind of like something out of, I don't know, like a sci-fi movie or something.
Yeah, it kind of does, doesn't it? So it stands for Chair-Sided Economical Restoration of Aesthetic Ceramics. And each part of that kind of tells you why it's so special.
Okay, I'm listening. Let's unpack that a bit. Chair side. So it all happens right there in the dentist's chair.
Yep, that's it, the whole thing. Like from when they scan your tooth to making the restoration, it's all done in one appointment.
So like no more going back and forth to the lab and dealing with those temporary crowns that never seem to fit right.
Exactly. It makes it so much easier on patients, more comfortable. And, well, there's also the psychological part. It's done, just like that. No more worrying about the next appointment.
Gotcha. Yeah, I could see why people would be pretty excited about that. What about the economical part? Does it like actually save you money?
Well, it can, but it's not like always a sure thing. Sometimes it's cheaper than the usual way, especially when you think about, all those extra appointments and temporary crowns and stuff. But the cost can change depending on how complicated the restoration is, what it's made of, and what the dentist charges.
So it's not like automatically the cheapest option, but the convenience factor itself might be worth it for a lot of people, right? Now, when we say restoration, we're talking about fixing a damaged tooth. Yeah.
Right. Cerec is all about getting your teeth back to how they should be, both how they look and how they work. And the cool thing is it can be used for a bunch of things: crowns, bridges, inlays, onlays, even veneers.
Wow, so it's not just about like fixing a chipped tooth. It's a whole bunch of tools for dental repair. Could you maybe like go through some of those? What exactly is an inlay, for example?
Okay, so imagine you've got a cavity, but instead of that, regular filling, they put in a special porcelain piece, custom made to fit perfectly in that spot. That's an inlay. It's like a puzzle piece that makes your tooth strong and the right shape again.
Okay, that makes sense. And what's the difference between an inlay and an onlay then?
Think of an onlay as like the big brother to an inlay. It covers more of the tooth, even sometimes going over the those pointy parts on top where you bite. They use it when the damage is, well, bigger than just a little cavity.
Ah, so it's like a bigger repair job. Got it. And then there are crowns or those for when a tooth is like really badly damaged.
Yeah, exactly. A crown is like a cap that covers the whole part of your tooth you can see, protecting it and making it strong and the right shape again. It's what they use when the tooth is weak, maybe from decay, big filling, or if it's cracked.
Gotcha. So we've got inlays for smaller fixes, onlays for bigger ones, and then crowns when a tooth needs a total makeover. What about veneers? Aren't those what people get for that, perfect Hollywood smile?
Yeah, a lot of people get them for cosmetic reasons, for sure. But you can use them to fix, problems with the tooth structure, too. They're these thin pieces of porcelain that stick to the front of your teeth, covering up things you don't like and strengthening the enamel if it's weak.
So they can fix chips, cracks, gaps, all that stuff that makes us, self-conscious about our smile. That's really interesting. So this technology is obviously super versatile. But what exactly makes it different from the way they used to do things? Is it just that it's all done in one equipment?
Well, that's a big part of it, for sure, the speed and convenience. But what's really cool is the tech itself. Cerec is all about like digital dentistry, so instead of those messy impressions and waiting weeks for the lab, it uses something called CAD/CAM to make the restorations right there in the dentist's chair.
CAD CAM. I'm not sure I've heard of that before. Sounds pretty high tech.
It is. It stands for Computer-Aided Design and Computer-Aided Manufacturing. Basically, your dentist uses a special camera to make a 3D scan of your tooth. No more of that gooey stuff you had to bite down on for impressions.
Yeah, I think everyone's happy about that. So what happens after they do the scan?
Well, that 3D image of your tooth pops up on a computer screen, and the dentist uses like special software to design the restoration. It's like sculpting, but, virtual. They can change the shape, size, even the color to match your other teeth perfectly.
So it's incredibly precise, like a digital blueprint for your new tooth.
Exactly. And once that design is done, they send it to a milling machine. Think of it like a tiny, super precise robot sculptor. It carves the restoration out of a block of ceramic.
Wow. Okay, so the whole process is like automated and incredibly precise.
And super fast. Usually, the milling only takes a few minutes, and then bam, the restoration's ready to be put onto your tooth.
That's incredible. But okay, let's be real. There's got to be, some downsides, right? No technology is perfect. What are the potential drawbacks of this Cerec thing?
You got it. There are a few things to think about. One is, well, it's not available everywhere. Not all dentists have the Cerec technology yet, so you might have to, search a bit to find one that does.
So it's not as common as, say, getting a regular filling?
Right, not yet anyway. It is getting more popular, though. Another thing is, Cerec might not be the best choice for every situation. Like, let's say you need a big bridge, or if your bite is really complicated, your dentist might say it's better to do it the old way with the lab.
So it's not a one-size-fits-all solution. There are still times when the traditional way is better.
Right, and it's important to remember that even with Cerec, the dentist's skill and experience are still super important. It's a tool, yeah, but the dentist's expertise is what makes it work well.
Okay, that makes sense. So we've covered the basics of what Cerec is and how it works, but now I'm curious about those ceramic materials you mentioned. What are they and how do they compare to the materials used in, the traditional restorations?
That's a great question, and it's one that people ask a lot. So the ones they use most in Cerec restoration are zirconia, lithium disilicate, you might know it by the brand name E.Max, and composite resin. They each have their own, special properties and advantages.
Okay, let's break those down a bit. Zirconia, that sounds familiar. Don't they use that for other things too?
Yeah, you've probably heard of it in like jewelry or even industrial stuff. It's incredibly strong and tough. Actually, they sometimes call it ceramic steel, and that's why it's great for back teeth, the ones that do most of the shoeing. It can handle all that pressure.
So zirconia is like the workhorse, the tough guy of dental materials.
Exactly. It's also really good for the body, and it's super resistant to, wear and tear, but it's not as translucent as some of the other ceramics, so it might not be the best choice for front teeth where you really want them to look good.
Makes sense. Strength and durability for the back teeth where it matters most. Okay, what about this lithium disilicate, or Emax, as you said?
Ah, yeah. Emax is known for how translucent it is. It's a really good match for natural tooth enamels, so it's popular for front teeth restorations where, looks are really important.
So it's like the beauty queen of the bunch. Strong, but also pretty.
Haha, yeah, you could say that. It's really strong and durable too, although not quite as tough as zirconia. It's great for people who want a restoration that, well, you can't tell it apart from their real teeth.
Gotcha. And what about composite resin? Isn't that the same stuff they use in regular fillings?
Yeah, it's tooth colored and it bonds directly to the tooth. It's good for, smaller restoration and can look really good too, but it's not as strong or long-lasting as those ceramic materials like zirconia or Emax.
Right. So it's a good all-arounder, but maybe not the best for restorations that need to be super tough or last for a long time. This is all really interesting stuff. But I think what everyone's really wondering is, how much does all this cost? Is Cerec like a luxury dental treatment?
Yeah, I bet that's the question on everyone's mind. And it's important, for sure. So how much it costs can depend on a bunch of things, like what type of restoration it is, how complicated the case is, the materials, how experienced the dentist is, where they are, and of course, your insurance.
Yeah, insurance can be a big factor in, any kind of dental work.
Big time. It's really important to check with your insurance before you do anything, to see what they'll cover and how much you might have to pay out of pocket. Some plans spend all of it, some cover some, and some, well, they don't cover any of it.
So just like any other major dental work, it's best to do your research first and have a straight-up conversation with your dentist about the costs. This has been really interesting, I got to say. We started with figuring out what that acronym means, then we learned about all the digital stuff behind Cerec, and now we've even gotten into the materials they use. It's a lot to take in.
Yeah, it's amazing how much goes into creating a healthy, beautiful smile these days.
It really is. But there's still so much more to talk about. So stick around for part 2 of our deep dive into Cerec dentistry, where we'll dive deeper into, well, the pros and cons, how long these restorations really last, and some pretty cool new developments that are, just around the corner. Welcome back. So before the little break there, we were talking about the different materials they use for these Cerec restorations. Zirconia, lithium disilicate, like E.Max, and composite resin. Are those the only options, or are there, others that dentists might use sometimes?
Yeah, those are the most common ones for sure. But there are a couple of others they might use in certain cases. Like sometimes you'll see dentists using something called lithium silicate.
Lithium silicate.
Yeah, it's kind of similar to lithium disilicate, but a bit different, in what it's made of. It's known for looking really good, and it can be a good choice for veneers or crowns, especially in places where there's not as much force from biting.
Okay, so it's another option in that, aesthetic ceramics family. That's interesting. Something I've been wondering about is like how long these Cerec restorations last. Do they last as long as the traditional ones made in a lab?
That's a good question, and it's one that patients ask a lot. How long any dental restoration will last, whether it's CEREC or the traditional way, depends on a few things, like how well you take care of your teeth, how hard you bite, and even where the restoration is.
So there's no like easy answer. It depends.
Yeah, pretty much. But generally speaking, CEREC restorations are pretty well known for being strong and lasting a long time. Studies show they can last for like 10 years, maybe even more if you take good care of them.
10 years. Wow, that's pretty impressive. So what can people do to, make sure their Cerec restorations last as long as possible? Besides the usual brushing and flossing, is there anything else to keep in mind?
Yeah, all the same good habits you need for keeping your own teeth healthy are important for restorations too. Brushing twice a day, flossing every day, and, seeing your dentist regularly are all key. It's also a good idea to avoid chewing on ice or hard candy, stuff like that. It can put a lot of stress on any restoration, not just the CEREC ones.
Makes sense. So common sense stuff, but it really does make a difference. It's kind of amazing to think that, one visit to the dentist can give you a restoration that could last for like a decade or more. That's got to be a sign of, well, how much dental technology has improved. Speaking of advancements, are there any like new things happening in the world of CEREC? Anything you're especially excited about?
Oh, yeah, absolutely. Dentistry is always changing. And, well, CEREC is keeping up. One thing that's really exciting is how they're starting to use artificial intelligence, AI, in the process.
AI in dentistry. Sounds pretty futuristic to me.
I know, right? It sounds like sci-fi, but it's actually happening now. Researchers are working on AI algorithms that can, help dentists design restorations that are even more precise and look even better. Imagine software that can analyze, 3D images of your teeth and tell the dentist the best way to design a crown or a veneer. It would take into account, your bite, your face, even your personality.
So it's like having a digital Michelangelo working with the dentist.
Ha! That's a great way to put it. AI could really change how precise, efficient, and, personalized CEREC dentistry can be. We're only just starting to understand how much it can do.
That's wild. It sounds like the future of dentistry is, well, pretty bright thanks to stuff like CEREC and AI. I'm sensing a theme here. Speed, precision, and personalization is like the holy trinity of modern dentistry. But with all this technology, I can't help but wonder about the human element. Does the dentist's skill and artistry still matter with CEREC? Or are the machines, taking over?
Oh, that's a really important point. Zero technology is powerful, yeah, but at the end of the day, it's just a tool. The dentist's expertise, their judgment, and their artistry are all still super important for a good outcome.
So it's like a team effort between human and machine.
Exactly. The dentist is still in charge, making all the important decisions about the treatment, the materials, and the final adjustments. They make sure the restoration fits perfectly and looks natural. Technology helps them, sure, but it doesn't replace them.
Okay, good. That's good to hear. I think sometimes people worry that technology is going to, make certain jobs disappear, but it sounds like in dentistry, it's more about making the dentist even better at what they do. It's a partnership.
That's it exactly. And that partnership means dentists can take even better care of their patients.
We've talked a lot about the good things about CEREC, but, I think it's only fair to acknowledge that it's not some kind of magical cure-all. Are there situations where, the traditional restoration might still be the better choice? Or are we heading towards a future where CEREC just takes over completely?
You're right. It's good to be, realistic. CEREC has changed a lot of things. Yeah, but it's not right for every situation. Like if you need a really big bridge that covers several teeth, or if your bite is really complicated and needs, super precise adjustments, it might still be better to go the traditional route with a lab.
So it's not about one technology winning and the other one losing. It's about, having more options for dentists and patients.
Exactly. It's like having more tools to choose from, right? You pick the best one for the job.
That makes a lot of sense. I think people get, excited about new technology, which is cool, but it's good to remember that it's not always the only answer. It's about finding the right solution for each patient, what works best for them. Now, I'm curious about something we touched on earlier about the cost. You mentioned that insurance coverage could be, well, kind of all over the place. Are there other, financial things people should think about when they're deciding between CEREC and the traditional way?
That's a good point. One thing to think about is the long-term cost. So even though CEREC might cost more upfront sometimes, it could actually save you money over time because they tend to be really durable and long-lasting. You might not need to replace them or fix them as often as you would the other kind.
So it's like investing in something, really well made that'll last a long time.
Exactly. That initial cost might seem higher, but it could mean less dental work in the future, which saves you money in the long run. Of course, you should always talk to your dentist about these things since they can give you advice based on, your situation and your insurance.
Yeah, I think that's a really important point from our conversation today, talking to your dentist. Whether you're thinking about Cerec or, any other treatment, having an honest conversation with your dentist about the good and bad, the costs and what you need is really crucial.
Absolutely. Dentistry is a very personal thing, and the best decisions happen when the patient and dentist work together.
Couldn't agree more. This deep dive into the world of Ceriarch dentistry has been really interesting. We've covered a lot from the technology itself to the materials they use, the pros and cons, that AI stuff, and even the money part of it. And it seems like this technology has a pretty bright future with even more cool stuff coming soon.
Yeah, it's definitely a really interesting time to be in dentistry.
So before we move on, I want to go back to something you said about AI in dentistry. It's a really interesting topic, but I think people might be wondering, how does it actually work? Are there like real-world examples of AI being used in CREC right now?
Oh, for sure. AI in dentistry is still, kind of new, but there are already some pretty cool ways they're using it. For example, some of the software programs for CREC now have these AI algorithms that can look at your 3D scan and give the dentist suggestions for the best design. These algorithms can take into account things like the shape and position of your other teeth, how hard you bite, and even how your smile looks to make a restoration that fits in perfectly and works great.
So it's like having a virtual dental assistant that can crunch all that data and give the dentist like expert advice.
Yeah, that's a good way to think about it. And that can be a huge help for dentists, especially with those really complex cases. The AI can help them make those tiny little adjustments to the design that would take, forever for a human to do by hand.
That's amazing. It seems like AI can not only make CEREC more precise and efficient, but also make the restorations, well, more like works of art, more personalized.
Definitely. It's all about using technology to make restorations that are both functional and beautiful and, really tailored to each patient.
That's a pretty inspiring vision for the future of dentistry. It's crazy to think how far we've come from, those messy impressions and waiting weeks for the lab to make something. Now with CEREC and AI, we're entering a whole new era of dental care, one that's faster, more precise, and way more personalized.
It's a great time to be a dentist and an even better time to be a patient.
Yeah, no doubt about it. Well, we've covered a ton of ground today, but there's still more to talk about. Stay tuned for part 3 of our deep dive into CEREC dentistry, where we'll wrap everything up with some final thoughts and, key takeaways for everyone listening. All right, so we're back, and we've really been digging into this whole CEREC dentistry thing. I got to say, it's been pretty fascinating. We started off trying to figure out what that acronym even meant, and now we're talking about, digital magic and robot dentists.
I know, right? It really makes you think about how much dentistry is changing. Single visit restorations and AI designing your teeth. It's pretty wild stuff.
It really is. Just imagine, they walk into the dentist's office, with a tooth that needs fixing, and then a couple hours later you walk out with a brand new permanent fix. It's the kind of thing you wish you had for all healthcare.
Definitely. It's a game changer, for sure. And it's not just about being, convenient. We were talking about how precise CEREC is, right? The digital scans, the design process on the computer, the milling machine, it all means you get restorations that fit really well and look, well, basically like real teeth.
It's like getting a custom-made piece of art, but for your mouth. And with the materials they have now, they're super strong too. We talked about zirconia, that workhorse material is perfect for the back teeth. And then there's lithium disilicate, which is strong and looks good, so it's perfect for the front where everyone sees it.
Yeah, the materials are pretty amazing these days. And with AI starting to get involved in choosing materials and designing the restorations, I think we're going to see some really cool, really personalized stuff coming out.
It's kind of crazy to think that AI could help dentists make restorations that, not only work great, but also look perfect with your face and your smile. It's like, I don't know, personalized medicine, but for your teeth. But even with all this high-tech stuff, I think it's important to remember that, well, CEREC isn't replacing the dentist anytime soon, right?
Oh, definitely not. The technology is a tool, a really cool one, but still just a tool. The dentist still has to know what they're doing and make the right calls every step of the way. From figuring out what's wrong and making a plan to picking the right material and making sure it fits perfectly. They're like the conductor of the orchestra, I guess.
That's a great way to put it. And it reminds you that the human element is still so important in healthcare. No matter how advanced the technology gets, you still need that, that connection with a professional you trust to guide you and answer your questions and make sure you're getting the best care possible.
I totally agree. Dentistry is a very personal thing, and you can't take that personal touch away.
So I think one of the biggest takeaways from all this is that you got to talk to your dentist. It doesn't matter if you're thinking about Cerec or any other treatment. You have to ask questions, talk about what you're worried about, and really understand what the options are, the good and the bad of each one.
Absolutely. It's about making decisions together, like a team. And I think, in a way, technology can actually make that communication better. Imagine being able to see like a 3D model of your tooth and seeing what the restoration is going to look like before they even start. That makes things a lot more, open and easy to understand.
It's like taking all the mystery out of dentistry, It puts the patient in control.
Exactly. And that's good for everyone. So as we wrap up this deep dive into Syriac, what are some things our listeners should remember? What should they keep in mind if they're thinking about, getting this done?
Yeah, what are the key takeaways here?
Well, first of all, don't be afraid to ask your dentist about Cerec. If you need a restoration, just ask them if it's, something that would work for you. It's all about knowing your options and making good decisions. And I think that's like the main message of all these deep dives we do. Knowledge is power, right? The more you understand about all these different technologies and treatments, the better you can decide what's best for you.
Absolutely. And when it comes to your health, you can never have too much information. So do your research, ask questions, and, don't be afraid to speak up for yourself.
Couldn't have said it better myself.
Well, this has been a really amazing look into the world of Cerec dentistry. It's a technology that's not only changing how we fix teeth, but also how we think about, the future of dental care in general. Thanks for joining us, and we hope this has been, well, informative and maybe even got you a little excited about the possibilities.
It's been great. Thanks for having me.
And to everyone listening, keep learning, keep exploring, and keep those smiles bright.